OT life hacker here with safety must in acute care. If you are a new therapist or fieldwork student in acute care, I hope this will be as helpful to you as it was for me. So I made this checklist for myself when I was doing fieldwork, and it was exceptionally helpful. I was able to just put this onto my working motor memory after about a week, because what I would do is I would study it during my off time and at home every night, wake up, rehearse it again, because safety is a must. You have to make sure that you're studying, that you're providing safe care for your patients. And when I say that I'm studying, I'm also studying the lab values, the precautions, not necessarily for specific patients, but in general, because I will have patients with all of these different needs. Every day is going to be different. So let's start off from the very beginning, the chart review. The very start to my process when I get my patients, chart review. So you always need to make sure you look at the lab values. If this is ICU especially, you're going to want to check those lab values and make sure that if you're seeing your patient, if they have some concerns with lab values where they're slightly under the normal, or they're kind of in the make sure you're monitoring that zone, make sure you're monitoring for symptoms. And if their levels are outside of the area that it should be, make sure you check that you can see the patient, that it'd be okay to see the patient. Check with the team. I cannot emphasize that enough. This is a team effort. And so these lab values, I actually have a whole list of the lab values here. And if you want another video on that, make sure you let me know in the comments below. And I also have vitals too, which we'll talk about just briefly, the lab values and vitals in this video, only briefly, because I do not want to overwhelm you guys. And so when I put this resource in the description box for you, you are going to see this, just this, because I don't want to overwhelm you guys. So again, if you want a video on that, make sure that you write it in the comments below. And yes, did I answer your question? I will be putting this in the description box below so that you have access, because I am so glad that the other resources I provided with you, the ones that I had made, the documentation resources, I've gotten so much feedback on that, on how helpful it's been, and even some progress in fieldwork on how it's made it so much easier for people. And I love to hear that and love knowing that. So that is why I make these videos for you guys, and I hope that this is just as helpful for you guys. All right, so precautions. Now, the hips, sternal, spinal, cardiac, make sure you're looking at the rate of perceived exertion, the MET levels, the energy conservation, and falls is pretty much always going to be a precaution that you have to be aware of. And also, I noticed that there's been some updates on the precautions. So I want to make sure that you know you always have to keep yourself updated. In acute care, there's always going to be changes, and you have to make sure you're staying up to date with those changes. That's what makes the most effective evidence-based care for your patients. Now, brace, splint, orthosis, cervical collar, do they have any of this? Make sure you check if they have it, and the usage of it, when they're supposed to use it. Because many times you go into the patient room and you can't find it anywhere, and they're like, oh, I don't have that. Because sometimes they actually try to hide it from you. And I've had that happen to me a few times where they're like, no, I don't have it. And then I talk to a nurse, oh, where is it? They're like, oh no, did they hide it again? And so you have to search around for it. Or you'll find them out of the bed without their brace or cervical collar on, so you have to make sure you're reinforcing the precautions. Now, weight bearing. This is especially important, weight bearing for ortho. Same with the brace, collar, and everything. That's very important for ortho and spinal. And then for head of bed, we have particularly for neuro. So this is very important if they had a craniotomy or encephalopathy. It is very important that you follow head of bed elevation precautions because it can help prevent intracranial pressure. Active activity orders is extremely important. You need to make sure that activity orders are current and up to date and active. I've had a few times where are the activity orders, or hey, is this still active? I talked to my supervisor, found out it's not, so we had to check with the nurse and the rest of the team. So you have to make sure, can they be out of bed? OOB, can they be out of bed? Because sometimes you have to do just edge of bed for care. And imaging, that may be important, especially if they just came from, like, again, craniotomy, or in other instances, maybe you got to check the CT scan or some other testing. Check the walker. Is the appropriate weight for the person, the max weight of your person, the max weight of the walker fits your person's weight, and that is the right height for them too. Always check with the nurse. That's very important. Did we say team effort, guys? Team effort and collaboration is extremely important, and especially for safety. Are there changes that happen overnight that you have to be careful of? Sometimes we've had patients that they had nausea, and you come into the room, they're very dizzy, their O&A is off because they had something happen, maybe medication, delirium. Pain meds. This is really important for ortho and for trauma too, because many times the patients will have injuries that are extremely painful. And seek clarification if you have to check on anything. And also, what I talk with the nurses often about is how to motivate patients. If there's patients who are known to be kind of difficult to work with, I need to know, how can I motivate the patient? What do you do with the patient that really gets them started in their day, or what catches their interest? Because your first impression, just like with any relationship, first impression is important. You go into the patient's room, you appear almighty, they'll be like, who are you? Right? So you want to make sure that you are adapting to their communication. And in order to do so, it's, while you're building rapport, that's important, sure, but also check in with the nurse on how the patient is, even personality-wise. I find that very helpful for the holistic approach. So check vitals, the pre, mid, and post. Very, very important. Inpatient, ICU, you must do this every time. Heart rate, oxygen. A tip that I learned is a pulse oximeter has the best readings when you put it on the third or fourth finger. Blood pressure. Make sure that you know the orthostatic hypotension signs, nausea, vomiting, sweating, and you look out for that. If there's a drop in the systolic blood pressure, systolic reading by 20, you have to, or over 20, you have to make sure you're checking. If there's a drop in the diastolic by 10 or more, you make sure you're checking. And that goes the same with the importance of the lab values. So lab values, you check this, as I mentioned, you check it because you want to make sure that you're monitoring. Something may happen during the session. There may be risk of syncope if the levels are low for the lab values. I think, like the potassium, we had a patient who became dizzy upon from supine to sit, edge of bed. She became dizzy, so we had to be very, very careful because she had low potassium per my chart review with her. And then blood pressure. As I was saying, the orthostatic hypotension, I've actually seen this not many times, but quite a few times with patients, and it's extremely important. Make sure that you are being always attentive and do your pre and mid vitals and post vitals, of course, but make sure you have the measurements ready to go, because you need to check. If you're doing supine to sit for patients who are very kind of, they're not very stable, you got to make sure you're checking. Now, make sure you have all the supplies. Do you have the adaptive equipment for the ortho patients that you need on hand when you go to see them? Because not only for the effectiveness of care and safety of the care, it's also for efficiency of care. You can walk into the patient's room and be like, oh shoot, I forgot the adaptive equipment, or oh, I'll just do assessment and I'll come back and bring the adaptive equipment to do the rest of it. That takes a lot out of your time and your productivity, so you have to be very, very careful. And then the ADL supplies, your towels, your hygiene supplies, your other grooming supplies. Make sure you have all of that. Set everything up. Sometimes you'll need to ask the nurse for help, especially in the ICU. They may have PICC lines. They may have the GI tube, the arterial lines. You got to make sure you communicate with the nurse to ask, hey, can we have that adjusted? And the oxygen tank, if they have an oxygen tank, make sure that you have the mobility device so that you can move the oxygen tank with you. And the telemetry, get that set up. The oximeter, always have that in hand, because again, you gotta check the vitals. Bed locked, catheter in place so that when you're doing supine to sit, everything's all set up, nothing gets tangled up. And then gait belt, you gotta put on your gait belt. And keep the wheelchair in hand for mobility. So that means when you're walking with the patient, and even if they're using the front wheel walker or no walker, or no cane, no device, you still gotta keep the wheelchair with you. Even if it's with for cardiac, if they have the cardiac walker, still, that doesn't change things. Keep your wheelchair on hand, because again, the vitals, the lab values, things can happen. The patient may get dizzy, or they may fatigue and they need to sit. You don't want an accident. You don't want to fall. You want safety. You want to help the patient out. So bring that wheelchair. After completion, make sure after you return the patient, you follow precautions. Again, head of bed if it needs to be elevated, the lower extremity if that needs to be elevated, giving them the call light, and plugging everything back in, modifying the rails as needed, and following all facility protocol. So, safety protocol. Make sure you are following your safety protocol for the facilities. Then let the nurse know that you're done and how the patient did. Again, emphasis on that communication, guys. And if you're ever unsure of something, discuss with the team. Your team is what's providing the care, not just you. Everyone is providing the care. So make sure you are being a team player and communicating. If you're ever not sure about something, check. It's always important to check. It's always better to be learning more than trying to do something out of just, mere confidence. Make sure you check with the team, because there's so much that acute care is always teaching us. Now, remember, if you want the lab values and the vitals as well, make sure you let me know in the comments below so that I can go over that with you, and I can put those links to those in the other videos. And again, that is because I don't want to overwhelm everyone with so much information at once, because you're also learning, and it's very important that you don't get overwhelmed, because that can help reduce burnout for yourself, especially when you're starting new. So it's very important to take care of yourself as well. And if you like this video and like these resources and are using these resources, please make sure you like and subscribe. These resources are all free, but it's super helpful if you subscribe, because it's helping to grow these resources for others to access. So I truly hope that you enjoyed it just as much as I did. Make sure you like and subscribe, and you can find me on Instagram at @OT_lifehacker. All right, I will talk to everyone later. Bye-bye.